Atherosclerosis is characterized by thickening of the arterial walls and plaque formation. Arteriosclerosis is a hardening of the arterial walls which may be caused by atherosclerosis, calcification of the arterial walls, or vessel wall thickening. Atherosclerosis is typically defined in 3 stages, but I prefer to start with endothelial damage as the initial stage. This is an image from nature. Pre-ASO, endothelial damage or dysfunction. The endothelium is the interior lining of the blood vessels and controls vasoconstriction, vasodilation, smooth muscle cell proliferation, thrombogenesis, clotting, and fibrinolysis, breaking up blood clots. When the endothelium is not functioning properly, the risk of damage to the arterial wall increases. Oxidative stress is one of the main causes of endothelial damage, and risk factors for damage and dysfunction include smoking, aging, dyslipidemia, high blood pressure, and hyperglycemia. Oxide, NO, is released from normal endothelium and is a potent vasodilator and crucial to maintaining arterial homeostasis. Stage 1. Fatty streak. Once the endothelium is injured, the body responds to damage with inflammation. Monocytes infiltrate the vessel wall and transform to macrophages. They act as scavengers, taking up LDL cholesterol. LDL becomes oxidized and accumulates within the macrophages, producing foam cells. The foam cells make up the fatty streak, which is the initial lesion in atherosclerosis. Fatty streaks can develop as early as 14 to 15 years of age. Stage 2. Fibrous plaque. The fatty streak gradually progresses to the fibrous plaque over time. The fibrous plaque consists of smooth muscle cells, macrophages, lipoproteins, and lymphocytes. The inflammatory process involves inflammatory mediators which stimulate the production and migration of smooth muscle cells to the innermost lining of the vessel wall. A fibrous cap is formed with the smooth muscle cells and deposition of elastin and collagen, creating a protective fibrous connective tissue layer. It's important to note that as many plaques progress and expand, the arterial wall expands, which results in little compromise of the lumen. Limitation of blood flow does not occur until plaques occupy about 50 to 70% of the lumen. Some plaques grow inward, and then the lumen is narrowed, and blood flow is compromised. Inward growing plaques typically lead to angina. Stage 3. Complicated lesion and plaque rupture. Eventually, the fibrous cap may weaken and rupture, exposing the underlying contents of the plaque to the lumen. When the plaque ruptures, it evokes the blood clotting reaction, creating a thrombus, and the body works to repair the rupture with a combination of fibrous connective tissue, inflammatory, and blood clotting components. When a plaque ruptures, it may expand into the lumen, limiting blood flow. If the thrombus breaks off and travels within the bloodstream, it is called a thromboembolus. As it travels through smaller vessels, which are more narrow, it eventually lodges within the vessel and blocks all blood flow, creating tissue ischemia. Plaque rupture is what causes acute coronary events, MIs, or unstable angina. But the size of the plaque does not determine whether an acute coronary event will occur. Plaques can be stable or unstable, and unstable plaques are more likely to rupture and cause acute coronary events. It's important to note that inflammation is involved in all three stages.